The other outstanding case that stands in front of my eyes is when I was in India, long time ago, in the 90s, I was also teaching exercise at one of the management schools. So I used to go there every morning and take their fitness exercise with instructors. I was the only so-called medical person there.
Right.
One fine day, one of the students in the group comes up to me and says, "Sir, I have a problem." "Yeah, what is it? How can I help?" So we took him aside and I was sitting with him and he said, "I'm having bleeding in my urine, blood in my urine. I've got terrible pains in my lower back. I've had an X-ray. There is a stone visible in my kidneys.
Oh.
And I'm booked for lithotripsy, so I don't want to do exercise. I should be given freedom from that."
Okay.
I said, "Well, we can do that, but would you be interested in doing something that may help you?" He said, "What?" I said, "Look, urine therapy is known to do this. If it helps you within the next 48 hours, you will change, and within the next 2 weeks, you could be normal."
That's fast.
It can.
Okay.
Whether it will with you, I can't promise, but it can.
Okay.
So would you be interested? He said, "Yeah, I'll try anything." Then he turned around and said, "But tomorrow I've got an appointment for lithotripsy, using ultrasound to smash the stones.
Okay.
What do I do with that?" I said, "Look, cancel that." "But will I get on?" I said, "That is my responsibility. If you don't have results within few days, I will organize a lithotripsy appointment for you."
Okay.
He said, "Okay." And then I gave him a regime. I said, "You drink Shivambu all day, Shivambu and water, and I think I must have added barley water also. So you have that all day and 24/7 consume it. Within 24 hours, the bleeding stopped.
Okay.
Within 48 hours, the pain eased off tremendously. End of the week, he was going to Bangalore. He was from Bangalore. He was going to Bangalore and his family had a few doctors there.
Okay.
So of course, everybody had heard about his stone. They had not heard about the rest of it.
Right.
So as soon as he got there, they took him away and said, "Oh, X-ray, X-ray," and they couldn't find the stone.
Oh, wow.
And when he came back, he said, "No stone, I'm feeling hale and hearty." And I said, "Look, you know one of the reasons why you may have got the stone? You're working 19, 20, 21 hours a day.
Right.
You are under high stress because of your commitments of college, the extracurricular activities, the load you have regarding campus interviews and all the stuff that the students organize.
Yes.
And all that put together may be causing the problem." And I said, "You're going to go into corporate world, so you make sure in your life that you do not get stressed like this all the time."
Right.
But that was a fascinating case and very satisfying to find complete recovery and perfect normality. I saw that student for another year and a half and there was no problem at all. And I can't even remember whether he continued Shivambu or whether he just discontinued. He would not have needed to continue Shivambu all his life. He might have required for 6 months and then he could have stopped once his functioning was normal.
Right.
So if people are thinking, when you start Shivambu, you should never give up. No, that is not the story.
Right.
If you're doing it for a particular illness or particular condition, then you may find that you can give up at a future date as long as the condition has been irreversibly cured.
Okay.
It should not be half cured, then it will come back. Okay?
It should be
So, it should be completely cured.
Yes.
It should not revert again.
Okay.
Now, if people are happy to do that, then that's good. A lot of people continue taking it all their life because they feel, "It's so good for me, why should I lose it? I
Right.
just get up in the morning, drink it and that's fine."
Right.
That's their prerogative, we cannot stop that. But
Right.
it's not necessary. So, all the listeners out there, don't feel if you're going to take Shivambu for improving your health, that you have to take it for life.
Right.
The third interesting case that I would like to share, which is unfortunate, but the outcome was not very good, but not on our behalf, but I'll explain the case.
Right.
We had a lady who had been suffering from kidney failure.
Okay.
And as part of that kidney failure, she was having dialysis 3 days a week.
Oh.
The doctors had told her and her husband that now it is already 3 days a week, somewhere in the next 12 months you might need a kidney transplant.
Okay.
Now this is happening in India. Okay. So India, none of these services are free.
Right.
So she was paying for dialysis 3 days a week, and she had to prepare for kidney transplant another year later, which means a lot of money.
Okay.
Okay. As part of that, with that much on her shoulders, her husband was told about me by somebody else. Now it is funny. People don't tell the person, that man will talk about Shivambu, it will be useful, go. They just say, he does something funny, you go and see him.
Okay.
Okay, they are not prepared to put Shivambu link there
Okay.
because they might feel uncomfortable. But anyway, he came.
Okay.
He came to me and we discussed at length, and I said, look, I cannot promise that Shivambu will cure your wife.
Right.
But we have had results to the point that patient improves. So we can give it a try. And I said, look, we cannot lose in this. She's having dialysis 3 days a week. She's going to go for kidney transplant.
Yes.
If the least we can maintain her 3 days a week, you will save money on kidney transplant. If we can bring it down to twice a week or once a week, you will save money, you will improve her quality of life, and she may survive longer. Plus, she will have lot more time in the future to go back to twice a week and 3 times a week. So we have bought time.
Right.
But for that, we need help from your dialysis specialist. And to do it properly, what I recommend is you go and see your dialysis specialist, tell him that you are trying something, explain to him that the day before the dialysis, you are doing a blood test
Right.
to check the creatinine level. And generally the creatinine level is high. And naturally you have to have a dialysis the next day. We are going to try something. If it is successful and if the creatinine level drops below us to a safer level, can you organize for us to have arrangements so that tomorrow's dialysis is cancelled or postponed to a day later?
Okay.
Because at this stage we don't expect she'll be able to manage without dialysis. But when we check the creatinine tomorrow and if we find the creatinine has gone up, she needs dialysis the next day.
Right.
And the husband said, okay. So he went to the doctor, discussed, and came back 10 minutes later with all joy. Doctor has agreed, we can do it. I said, okay, let's do it.
Right.
So I got involved, put the lady on a fast, drink lots of Shivambu, drink lots of coconut water, and all the other things that I do for kidney patients of that order, keeping her needs in mind. This went on for about 4, 5, 6, 7, 8 weeks. I can't remember exactly how many weeks, but fair bit of time because the results didn't come straight away.
Right.
And the husband would go get the blood test done, come to my office, clinic, show the test and say, no change, okay, keep going. One fine day he walked in happy as anything.
Right.
The काय result चांगला आला का? Are the results good? He said, yes, the creatinine has dropped.
Right.
I said, okay. I said, now you have to go to your doctor, talk to him and tell him, doctor, we had agreed tomorrow's dialysis, can you postpone it today after? And tomorrow we'll repeat the test again.
Okay.
And he came back 10 minutes later, nearly crying. I said, what happened? He said, oh, the doctor said that we can't do that, we have got bookings, we can't adjust it, we can't do this, we can't do that. Basically, did not cooperate. I was very angry at that time, thinking, why did he tell us to do that? Otherwise, why did I need to put the patient through so much agony?
Right.
Okay. Later on, I realized that maybe he never had the intention to carry out this favor. Maybe.
Yes.
I'm only guessing. But he thought, they are trying something rubbish, let them try it, it's not going to succeed, why should I bother? I will say yes.
Okay.
So he may have said yes. He may have.
Right.
But now that it has come back to bite him, he doesn't want to accept it.
Yes.
And if that was the case, why didn't he tell us in the first place, I don't believe in it, I don't want to do it? We would not have put his wife through so much agony.
Right.
That made me more angry. But then we can't just go ahead and tell patients, stop dialysis. You die, we will improve you, otherwise, what will be? When you have got a good system where they are keeping you alive, then you should work together with the dialysis unit and try to get results the best way you can. And there's no guarantee that she will come off dialysis completely. She might have dialysis only once or twice a week.
Yes.
But it's still saving the institution, they can treat more patients.
Right.
Saving the patient money,
Yes.
saving the patient's kidneys, giving the patient better quality of life,
Yes.
and hopefully a longer life.
Definitely.
So these are the three cases I thought I should share. There are a lot of other cases, but we should not go into only sharing cases.
Okay. Yes, yes. That's nice to hear all those case studies. Let's move on to next question. Where do you feel you are with Shivambu today?
Very interesting question. Thank you for that. Over the last 25 years, I have been striving to bring Shivambu onto a scientific pedestal. When I say scientific, I still believe that if we can prove to the world that scientific basis of working of Shivambu is evidenced, the world may accept it as with an open mind.
Right.
Today, as most Shivambu practitioners and followers know, it is a taboo subject. But it is such a powerful entity helping people. And over the last 25 years, the number of people I have helped, it gives me great satisfaction to know that they have benefited. So why not make this a public thing for others to use on a proper scientific pedestal? So that has been my quest. I earlier talked about the different theories and different possibilities. And I'm still in the quest for looking at how can we convince the world of this magical therapy or miraculous therapy, as some people like to call it, that can change the future for most of us.
Right.
So, I'm in a way struggling, fighting, and trying to fly the flag of Shivambu as best as I can to as many people as I can within my power to help them gain better health. That is where I am today.
How has Shivambu changed in last 25 years in your perspective?
That is very hard to tell. I can see I come across a lot more people who follow Shivambu. I can see there are a lot more Shivambu friends who are prepared to go out and talk about it these days.
Right.
Whether it's a case of I am meeting them more often, or whether it's a case of they have actually increased in numbers is hard to tell.
Right.
The sad fact remains that the suffering community is still 95, 98, 99% of people are suffering.
Yes.
So obviously, even if we have made some progress in propagating it, we have not succeeded enough that the majority can make use of.
Yes.
One of the things I feel very strongly about is, and that is one of the reasons why I want to use YouTube as a channel, is it can get into everybody's private life safely without disturbing or without letting other people know that they may be practitioners of Shivam.
Right.
Okay? So it gives them the privacy to read, understand, listen, grasp, absorb, develop the skill, practice, and not tell anybody.
Exactly.
And if they get benefit that way, why not? That is what the whole world is about, to give people benefit. So, when I see it in those terms, I feel very happy that there are more people doing it. When I go on YouTube, I see a lot of videos. Unfortunately, a lot of the videos are not as informative or accurately portrayed to provide convincing arguments about Shivambu, which is sad. I know people are taking a lot of trouble to share their experiences, but People are not adding to that by saying this is why you must do it, this is why you should do it, this is the precaution you should take, this is why you should not do it, these are the areas of problem areas, etc. If only they did that, maybe people may be more open. But that is my observation, that people are sort of slowly going towards that end. The other thing that I have seen in 25 years of health, or a bit more of health that I have been working in, is I observe that the frustration of chronic disease sufferers is slowly going up every day, because they suffer with pain, they suffer with problems, they suffer with deformity, they suffer with discomfort, and there appears to be no end in sight. Allopathy does not seem to afford enough change. Ayurveda doesn't seem to afford enough change. Some people benefit, a lot don't. But Shivambu can do a lot, and people are turning to any pati to get results. Maybe that is a good thing for us.
Yes.
And we can use that to benefit them, and if we benefit them, others can learn from that. But that is what my observation says over the last 25-30 years.
Okay. So we discussed about last 25 years observation of yours, today the condition of Shivambu. What do you think about the future for Shivambu?
I'm a very optimistic person. So when I think about the future of anything, I always think very positive things. Looking at the transition that I have seen in the last 25-30 years, and looking at the effort that we are putting into Shivambu propagation, I would like to optimistically think that in the next 25 years, Shivambu may become a more mainstream acceptable modality, even though it may not be as fully understood as people wish to, but practice to get results. And when people get results, generally they don't mind doing anything. If that is true, then it is only fair that Shivambu can only keep improving in terms of public appeal, public benefit, and easing of suffering. I would like to think that the next 25 years should be a very positive journey for Shivambu, and I hope it stays that way.
Okay. So, if we see the teaching about Shivambu, what do you challenges faces in all the teaching process of Shivambu?
For me?
Yes.
Oh! See, when you start talking about teaching Shivambu, you have got 2-3 different levels. One is teaching the patient. Second is teaching the practitioner. When we are talking about teaching the patient, we need to teach them about why is Shivambu useful. We need to be able to explain the biological background. We need to explain the chemical changes. We need to explain the things that are likely to occur if you take Shivambu. Benefits, effects, and thus maybe easing of suffering. You need to be able to explain the time plan. So if you take Shivambu starting today, what will happen in the next few days, what will happen in the next few weeks? Because eventually everybody who listens to you is going to follow it and depend on what you have told them about the prospects. If what you have explained comes true, they are going to believe you.
Exactly.
If what you tell them doesn't come true, they say, just talking through his head. Okay.
Yeah.
So you need to be very well educated in when you are prescribing to a patient and explain it properly to say what is going to happen, what are the changes that are going to happen, when will you experience it, how do you experience it. Now one of the tricks in that in educating and working with the patient is a lot of times patients do not know that they are improving due to Shivambu.
Yes.
So when you just ask them, have it been helpful? They say, I don't know. And then you talk to them and say, are you sleeping better? Oh, since the last 4 days I started taking Shivambu 8 days ago. Last 4 days when I go to bed I sleep like a log and I wake up fresh. Are you feeling more energetic? I come to think of it. 2 days after Shivambu, I've been feeling very energetic.
Yes.
Have your bowels moved better? Why? A week after starting Shivambu, my bowels are like flushing out.
Yes.
And then when I ask them, So you don't think anything changed? Oh, now that you mention it, all these things have changed.
Yes.
So sometimes people are not aware of what to expect. So changes they may look at and say it is not due to Shivambu.
Yes.
So it becomes the responsibility of the practitioner talking to the patient to educate, assess, review, and then draw this timeline explaining how Shivambu, its effects are happening and how that person is benefiting. Then their eyes are open and they go, okay. So that is what is happening.
Yes.
When it comes to practitioners, it's a completely different ballgame. With practitioners, you need to educate them about how to learn about Shivambu. What are the detailed prescriptions you need to know? Why do you need to change prescriptions? What is the logic behind those prescriptions? What problems you can encounter with them? How do you overcome those problems? How to be safe when handling patients in your practice? How to make sure you work with medications? So it's a different ball game when you're talking to practitioners and slightly different when you're talking to patients. But these are things that need to be followed very stringently if you want to do a good teaching job.
Right. Okay. Thank you, Mr. Anand. I heard a lot of amazing things about Shivambu. I am very pleased to learn the scientific way of your Shivambu, your experiences, your case studies, and that truly going to help our future generation and the people who are living in this generation through the Shivambu. Many, many thanks.
Thank you very much.